You for accepting our invitation to meet with very nice, elegant people like you. Thank you very much. Of course, this year we are celebrating the 25th year of initiating Memorial Health Group. Memorial Health Group started as a single hospital in Şişli, Istanbul, European side, in year 2000. It was the first establishment in the medical field for our holding. Memorial Hospital is one part of Aydın Holding, which owns also A101, you may know it, the market A101. Also, English Home, Kaçarel, Pierre Cardin, Touch, Linens, all these companies are under the same roof of Aydın Holding. The initiation of Memorial Hospital, actually, it was an establishment just to try to help people, not gaining money. This was the initial aim of initiating Memorial Hospital. The family started it as one hospital, and then during 10 years they waited a lot until year 2010, and they said, okay, now we are very good in this field, we can do more job helping Turkish people and the international patients. Memorial, also known as a pioneer in initiating very good facilities and treatment plans in the private sector. Our hospital in Istanbul was the first one in the private sector to do organ transplantation, like kidney and liver transplantation in the private sector. Also, we were the first private hospital in Turkey gaining the JCI accreditation, which is the most and valuable high-level accreditation in the medical field. And also it is accredited internationally. Of course, during the years, our hospitals started to grow up and reach, at the time being, 11 hospitals. 3 of them in Istanbul, 2 in Şişli and Bahçelievler in the European side, 1 Ataşeler in the Asian side, 1 hospital here in Ankara, 3 hospitals in Antalya, 2 hospitals in Diyarbakır, and 1 hospital in Kayseri. Before 3 years, we started our first outside Turkey hospital in Romania. This was our opening to the European Union. And that hospital is accredited in the European Union's insurance companies. And European patients, they can go and get treatments covered by their insurances in Romania. Of course, in the near future, we will be opening our newest hospital in Bodrum. As you may know, Bodrum is the most famous touristic site in Turkey. Also, after 3 or 4 months, the biggest private hospital will be opening in Istanbul, Memorial Göztepe Hastanesi. It's 450 beds, very huge hospital. The most important thing that Memorial is very well known in doing big jobs in the medical field. Of course, we have dental services, we have aesthetics, cosmetics, and everything, because this is the whole medical treatment package you have to provide. But we are famous with the robotic surgeries. As you may know, previously the heart surgeries were done with cutting the whole sternum and opening the chest and putting the patient in the intensive care units for few days, 3 days, 5 days, and after that 10 or 15 days inpatient admission in the hospital. But nowadays we are doing it only with 2 holes. or a minimal invasive, very small opening in the left side. The patient staying 1 day only in the intensive care unit and 3 days in the normal regular floor, and after that he is going back to his work or driving home by himself. So a lot of advantage of the technology is coming, and we are getting benefit of that. Of course, we are not using the robot only in the cardiac surgeries. We are using it in the hip and knee transplantations. We are doing all of them through only few holes. The same operations are done for gynecological operations, for general surgery and urological. With the assistance of this device, we are changing the whole urinary system. We are removing the bladder and making new bladder inside the abdomen using the robot without any cuts. So the robot is very, very, very important to us. Of course, other than that, now in our hospital, we are having one of the most famous plastic surgery and reconstructive surgeries professors. With him, we are building our plastic surgery and starting to do very good operations in the plastic surgery, reconstructive surgeries. And the last year, we started doing bariatric surgeries. The bariatric surgeries are, designed for the heavyweight, the people that are not able to do diet and get rid of the excessive weights. And most of them, they reach critical weights, which affects the heart, the liver, diabetes, and other fatal diseases. And now the new medicine, the new technologies are helping us to give them better life. Actually, in these two specific topics, our professors will be giving you a short presentations, and you will have time to ask them whatever you want. Their card visits are on the tables for both of them. Also, you can contact them directly if you need, or contact them through our team. I don't want to take a lot of time. Of course, we will have a time visiting the hospital, and you may ask me or my colleagues a lot of questions. We will be happy to answer them. And I want to host our Dean, Mr. Irfan Niazi, to give his speech.
We are very happy to come over here as a group, and of course we are very thankful for the hospital management for giving us a family time and also giving us orientation. Of course, belonging to the different embassies, we have been going to various hospitals in Turkey, and this has been also a good addition. I was talking to a few of the DAs, and they are already in contact with the Memorial Hospital, and I'm sure that after this orientation, probably you would be having an increased number of customers in your list. But then I would be requesting that don't take it that everybody is getting dollar or pounds from their embassies. Sometimes the DAs are also expending a lot of money on the medical from their own pocket. So at least find some economical package for us, where the bill is not making us our blood pressure shoot to that level that for an additional expenditure we are coming back to you.
We'll try hard to do that.
Yeah, thank you very much. So many thanks to the hospital management. We are looking forward for enhancing the operation, and of course as a dean of the AMAC, I will be available for any kind of help which we can extend to you. As a token of appreciation, I have something, so I would request of one is the cosmetic. Don't worry, I have the contacts with them in my pocket, so anybody wants to just consult them, use my contact number, they are going to give you in their
Surgery specialist. I have been involved in obesity surgery the last 15 years. I will give some information about obesity. According to World Health Organization, obesity is defined as abnormal, hyperplastic or excessive weight, fat accumulation in tissues to the extent that impairs physical, social, and mental health. Obesity is one of the most important health problems in the developed and developing obesity. Approximately 1.2 billion people are overweight, and about 800 million are obese. In the 2035, 1.9 billion Earth's population will be obese, and 1 out of every 4 people will be obese. And estimated approximately $4.32 trillion will be spent obesity and obesity caused by obesity disease. Obesity has passed the epidemic stage and called pandemic like COVID-19 pandemic and a bomb ready to explode. The reason for obesity are quite complex. Genetic and environmental factors is role obesity. And when obesity is not treated, after it has set in, complication and additional disease begin emerge. Excessive and wrong eating habits, inadequate physical activity, psychological problems, frequent low-weight diets, age, gender, education level, socio-cultural factors, income status, hormonal and metabolic factors role play the obesity risk factors. Obesity is not only a problem itself, but also causes significant health problems if the disease it brings. Obesity causes disease such as type 2 diabetes mellitus, hypertension, coronary artery disease, hyperlipidemia, metabolic syndrome, gallbladder disease. It's important that, in addition, obesity increases the frequency of developing some types of cancer, such as gallbladder, endometrial, ovarian, and breast cancer in women, colon and prostate cancer in men. How we define the obesity? Obesity, the most common method we use to define obesity is the body mass index. Body mass index is value obtained by dividing a person's body weight by the square of their height in meters. Under 18, underweight, 18, 25, normal weight, 25, 30, slightly overweight or pre-obesity, 13, 35, called obesity, above 35, severe obesity. Treatment, obesity is now accepted chronic disease that must be treated around the world. As with all chronic disease like diabetes and hypertension, treatment should be continued throughout.
First of all, it's a great pleasure to host you here in our hospital. First of all, I want to say you that I'm sorry for my rusty English. I can speak as clear and fluent English as Dr. Cengiz. I may stuck sometimes. Please, sorry about this. I would like to give you some information today about current aesthetic, plastic and reconstructive surgery approach. First of all, what does plastic, reconstructive and aesthetic surgery mean? Plastic is the word is coming from Greek, and plastikos, it means to shape or to fit into a mold. Reconstructive is the mold word of Latin origin and means to make again. And aesthetic is the common concern of beauty and varies from person to person in the clearest definition. What we do, as you can see, we deal all over the body. We are topographic surgeons. We deal all over